Hi everyone, and welcome back to my YouTube channel. It's so exciting to have this channel and to be able to share some ideas, nursing related, and just about life in general. So yes, today I'm gonna talk about how it's like to be a student nurse. So I'm sure all the nurses on their first day on placement, they remember how scary it was. It must have been, probably didn't sleep the night before, just had to make sure everything was perfect. You are in your uniform, you had your little book, you know, where you'd be writing all your notes and new things that you'd learn. My experience as a student was mixed. Now, the first day of my placement back years ago, it wasn't that scary. I was nervous, but I just had a really good ward and a really good preceptor who just made me feel comfortable. And I was like, yes, this is for me. Now, I'd never really been in a hospital before, so I didn't really know what I was expecting. I had an idea of what nursing was about, the clinical setting, but I knew I always wanted to work in a hospital, and I always wanted to care for those who were sick to help them feel better. So my first day was on a medical ward. I remember my preceptor was so lovely. She was so friendly, and one thing that I remember is that I connected straight away with the patients. I was able to just talk to them, communicate with them, and that is what you want, you know, on your first day. If you are a student nurse and it's your first day, you're going to a ward, medical or surgical, you want to be not scared. You literally need to tell yourself, I'm gonna go in, I'm gonna give it my best, and I'm gonna be nice and friendly and gonna be myself, and I'm gonna learn as much as I can along the way. So you want to have that attitude on your first day. So yes, my first day I was able to connect with the patients, connect with my preceptor, and it was great. So the first things that you probably learn, depending on which hospital or which part of the world you're in, but I'd say it's general around the world. First thing you learn is you'll be in report. So the nurse that was in caring for those patients that night will be finishing in the morning and giving a handover. And that for me was the scariest part, because it just sounded like gibberish in my head. All these terminologies, ECGs and CT taps and all of, I was like, what's that, what, who, where? I just didn't know what it was all about. But listen, you're not expected to know all of that. It's just your first day. You are expected to just take in as much as you can, learn along the way, and connect with the nurses looking after your preceptor or your mentor. I don't know what it's called on the different places, but connect with him or her. You're expected to also just connect with the patients as well and learn little things along the way. So your first week or your first 2 weeks, you're gonna just learn how to do the vital things. So vital signs, taking blood pressure, checking the temperature, checking the heart rate, checking the respiratory rate. Now, there's different techniques for checking the respiratory rate, but I've always been taught to count the full minute. You're gonna have your fob watches. It's best to count the full minute. And one thing I was always taught is that counting the respiratory rate of a patient is one of the most important things, because if the patient is deteriorating in any way, the first thing that's gonna go down or change is their respiratory. It's not gonna be great. They might breathe a little bit faster, they might use their intercessory muscles. If you see a patient doing that, that is one of the signs you should be like, something's not right here. So yeah, that's kind of like the first things that you need to learn, vital signs. And once you do, listen, it just flows. It really does. So that was my experience first few weeks. Now, if only we could have that one good preceptor for the whole of the 4 years of training, But unfortunately not. You get to have different preceptors, and you get to like learn how to deal with different people and different characters, you know. And some preceptors absolutely love teaching, and some preceptors absolutely hate teaching. And it doesn't mean they're bad nurses, they just don't like it. It frustrates them, they can't concentrate, they feel like it's all too much. But whatever the case, if you feel that, you know, you're not really learning much, or try and sit down with your CPC or somebody who is in charge of the student, the main person, and just explain to them how you feel, because no one should have to suffer in silence. That is one thing, no one should have to suffer in silence. So yes, if you're a student nurse, be on time, and always inform your preceptor when you're going on your break and when you're back on your break. Communication is so important. That's like the key thing, and you're going to need it in your student life and in your nursing life and in your life in general. Communication is key. So yes, I'm sure in your clinical areas, they should teach you how to manually check blood pressure. That's one thing I've seen that a lot of the student educators are really keen on, that you need to learn. And unfortunately or unfortunately, when you become a nurse, you don't really use the manual blood pressure, unless the Dynamaps or the blood pressure machines are broken. They just want every nurse to have that skill, because you're not going to always have that machine. So get yourself a manual blood pressure and practice on your friends or your family members. It's great. Listen, it's great to be able to say, I can check blood pressure. You want me to check your blood pressure? You want me to check your blood pressure? It's fun. It's great. It gives you a sense of power, you know. So it gives you a sense of confidence, I feel, as a student nurse. So go for it, you know. Other things you want to learn: bladder scans. They're handy. They're honestly not as hard as people make them out to be. Learn how to say a patient is retaining. So they're retaining urine, they're not passing urine. You want to learn how to scan their bladder. It's very, very straightforward. I don't know which machines are used in different areas of the world, but it's literally like an ultrasound of the bladder. Just put a little bit of gel. You have the little knob for scanning the bladder. Press the machine, just scan around, kind of a little bit of pressure, explain to your patient, communicate, gain consent, put a little bit of pressure underneath, and try it at least 3 times, and then get one number from the 3 that you've done that you think is the most realistic, and show your preceptor, because obviously you don't want to be doing these things on your own. If you're first year or second year, there's different levels. There's things you're supposed to be doing on your own, or things that really you should be supervised with. So there's that. What else can you learn? Checking blood sugars, you know, that can be a little bit tricky to get the hang of, but once you do, listen, you'll be flying it. You'll have other nurses asking you, do you mind checking my blood sugars? Do you mind checking my blood sugars? And it just, yeah, gives you a sense of confidence, you know? So yeah, there's that. Blood sugars, blood pressures, vital signs essentially, bladder scanning, and documentation. Now, I'm not sure if as a first year you're going to be expected to learn how to document on a patient, but you know what, go for it. Even if it means just writing a small paragraph, go for it. The sooner the better. And really, it's just writing what you've done. So if you're first year and that morning you went and you washed the patient and you got them dressed, you helped them sit out, you did their blood pressures, vital signs, and say they were a diabetic patient and you checked their blood sugar. And then in the evening time, you check their blood pressures again just to make sure they're okay, and you check their blood sugars. That is perfect to put in a paragraph, and it's excellent because you're just writing exactly what you did, the time that you did it, and you sign off your name, and that's it. Honestly, it just takes practice, confidence, and knowing that you can do it. So that is my little help tips for first year students going into your placement. If you're scared, you're frightened, if you're like, I don't know how I'm going to do this, you can do it. If everyone else has managed to do it, why can't you do it? You can do it. So yes, that is my help tips for student nurses. Our quote for the day will be a verse in the Bible, and it says, I can do all things through Christ who gives me the strength. So yes, that's it. Thank you all for watching. Until next time, stay blessed, stay safe. Bye.